on to our weekly COVID-19 update with Kathy and, yeah, Jamie, are you going to join us? I didn't know if you were coming up or not, so.
You said I could come only if I talked fast. Good morning.
The word's
Mr.
out, huh?
Chair. And we talk really fast. Okay, look at the numbers.
Thank you very much for your report.
Okay, you're welcome. Have a great day.
All right, good morning.
Good morning, Mr. Chair and Commissioners. So I handed out the information on the numbers. So it shows our cumulative cases at 6,701. There's an increase from last week, but you know, not huge. That was 6,667. So we've got 6,701. So it's a little bit up. Minnesota is 468, 682. So a little bit up from last week, but still not big surges. The cumulative deaths, if you noticed last week, I had 84 listed, and they changed that. One death they had attributed that it was in Clay County. It was a Clay County resident, and it actually wasn't. It was in another county, so they took that death off and put it on the other county. So it's 83 deaths. And then 6,302 in Minnesota. So it lists the number of people out of isolation. So our active cases are 69. Last week, we reported them as 99. So we're reducing the numbers of active cases that we're following. So the numbers are good. That's great that we have less active cases and less circulating virus that we're following. So hospitalizations still, cumulative hospitalizations 280, and then the 24/780. So our hospitalizations in ICU and in the regular hospital are manageable, and no increases in those hospitalizations. And then our 14-day case rate per 10,000 is 3217. So that's also down from last week, so that's really good. You see the graph at the bottom, just again, the Clay County cases per week. So not really any changes from last week, obviously. And then the cumulative cases by age group on the next page. So the 20 to 24 is the age range that was the highest cumulatively. And then you see the active cases by age group on that second graph. The 15 to 19-year-olds and the 20 to 24-year-olds are the active cases by age group currently. And then the third page is hospitalizations, ICU, and so those are just the statewide data. 24,565 hospitalizations and 5,079 in ICU. So those numbers are stable, as we call that. And then I talked about the deaths. So we certainly haven't had any additional deaths, and that one death was reported in the wrong county. So we have the 83 deaths. I'll let Jamie talk about the vaccine distribution in just a second. I was going to mention our saliva testing site is still in operation. We don't have an endpoint yet. They initially were going to be done at the end of December, but they continue to be able to operate across Minnesota, and so our testing site is still available, and we have that on our website as far as the hours and operation times. The number of tests that they're being conducted, the second and third week of January, it was in the 2,000, about 2,000 people per week. This last week of January 31st, there was 1,647, so it was down a little bit, number of folks that were being tested. And of course, those are Minnesota residents and North Dakota residents that are able to go to the testing site. There was a little bit of a glitch with North Dakota Blue Cross Blue Shield, where some folks were getting bills. And this testing site is free, there's no out-of-pocket costs. I connected North Dakota Blue Cross Blue Shield with Vault management team to fix the way that was getting billed, and folks were receiving some bills as well. But this is a free testing site. They will bill insurance and try to recoup some of the costs by insurance payments, but there is never a cost to individuals. So if there's an issue, that they can just contact public health and we'll work through that process. Any questions on the data? I went pretty quick. Otherwise, we'll move over to Jamie and she'll talk about the vaccination information.
Okay, so looking at the data, basically Clay County compared to Minnesota, we are the total number of people with at least one dose of vaccine, 10.5%. 6,580 citizens in Clay County versus 10.1% of the population in all of Minnesota. And then the total number of people completing the vaccine series, 2.7 in Clay County and 2.9 in the state overall. People aged 50 to 64 with at least one dose in Clay County, 13%, and 10.7% statewide. And then people age 65 with at least one dose of vaccine, 30.7% in Clay County and 27.4%. So we're doing better than what they have been portraying us in our region. And our strongest competitor has been Monoman County, which is White Earth Reservation, actually. So we're doing pretty well. And we did get a little bit of a late start without having our hospital. But Clay County Public Health has requested a lot of vaccine. We've gotten it and we've distributed it, and it's kind of slowing down because we now have more opportunities for vaccines. So you probably saw retail pharmacies receiving the limited doses are still an issue, but they're being distributed to pharmacies and clinics and public health as well right now, and still coming through our hospital associations. The bottom line there, if you look at that 3-day goal, that's a statewide 90%. Clay County Public Health has been at 72%, or 72 hours, meeting that goal on a weekly basis. Last week, we gave 1,000 doses and again met that 72-hour timeline. This week, we are doing just 400 first doses, and we're starting on our second doses. We're giving 200 of second doses this week. And just want a quick reminder of the phone line that we have set up in the county, the 218-299-7204, for information for people on where they can get vaccine information. And then also on our county website, there's an e-newsletter that they can register for as well. So that's claycountyminnesota.gov. And if you click on the COVID-19 link for information, you can also get that newsletter that's available to the public. And that's it.
Can you repeat that phone number for the?
The phone number is 218-299-7204.
Questions? Commissioner?
I have a question. As part of our Minnesota Rural Counties meeting yesterday, there was a discussion about vaccine rollout and the frustration that rural community hospitals are feeling in Minnesota. I think their major concern is they don't have the pharmacies that some of these bigger areas have, and so they're just seeing even less vaccine in their counties than even we are. It sounds like they're taking a pretty strong stand in terms of writing letters of support to make sure we can get more vaccine out to rural Minnesota. Are you aware of those conversations?
Yes.
Okay. All right. I think the other piece just to note is one, thank you very much for rolling out the vaccine in such a swift manner. Two, that 10.5% of the population is probably low based on what it really is. Are you including Sanford and anyone vaccinated on the North Dakota side? Is that in that 10.5?
No, not at this point. Minnesota, MIC, they're requesting that the Minnesota Information System get that information from North Dakota. It may be rolling by now, but it was a delay of at least a month.
Right.
So I think that's an example of the picture is probably more rosy than what the data really does say. So thank you for your work.
Yeah, thank you.
Well, it's really encouraging to see the active cases way down, and I'm assuming that's also then helping with your contact tracing work that has to go on, so
Right, yes.
there are additional benefits to see these numbers down, and obviously it's very encouraging to see that. And obviously, I think the fact that, well, obviously, a lot of folks have already had COVID, but then the vaccine getting out there, I think, is really showing to be effective, so get your shots, everybody.
That's right.
Okay. Yeah. Commissioner Gailey.
Jamie, when we talk about herd immunity, so we're seeing, 10% that we know of have been vaccinated. We know that there's more than that because of, that delay of information you just talked about. What is the target percentage of vaccinated population for herd immunity?
And I don't know the answer to that question. Is it 70%?
Yeah, about 75% for those that would get the vaccine.
Yeah,
Did know, yes. You can get herd immunity from people that are, have received, or that have COVID, that have some immunity, but of course, that's not the way we want people to achieve herd immunity or community, so it would be through vaccination, so about 75%.
I think I read that once you get to 50%, you start to see it, but to get the true, where it really starts to eliminate the spread is in that 70% range.
Right, good question.
All right, anything else for Kathy, or, yeah, go ahead.
Thank you, Mr. Chair. Unrelated to COVID, but what are you seeing in terms of influenza rates in the community? I think if masks work, that data is really a testament to them working. Do you have any numbers?
I don't have the specific percentages, but I know our epidemiologist said the numbers are down for the influenza across the state. So clearly, some of the preventative measures that have been used for COVID are working for influenza. So that's really good.
Thank you.
All right, thank you very much for your
Okay.
report.
Thank you.